5-Minute Pearls for Clinical Practice. Today's pearl is called the Tickler File. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. This week's pearl is called the Tickler File. In the last podcast episode, we discussed a very important organizational strategy for clinical practice. If you missed that episode, go back and take a listen to it because it was very important. We discussed the concept of batching, where we batch together our work to optimize our time management. For example, if we need to review some journal articles, we batch together a whole bunch of articles and read them at one time, rather than reading one or two now and then another two in a few hours. We batch together our work to optimize our time management. Or another example might be if we want to write letters to our patients. We write a batch of patient letters together rather than writing one now and then one later and then another one after that. We try to batch together our projects so that we can do a lot of similar projects back to back to back rather than spreading them out throughout the day. This way we practice optimal time management and find a workflow where we can minimize time spent getting ready for a specific project or transitioning between jobs. This week, let's talk about another very important strategy for optimal time management, the Tickler File. This is something that I wish someone had taught me back in medical school, but it's something that I learned early on in practice, and I have used it ever since. For those who don't know what a Tickler File is, it is an organizational tool, either paper or digital, where we keep track of items that we need to follow up on. For example, let's say that we see a patient on Monday and order a certain test. Let's say we order an ultrasound of the abdomen. The test may not be done for several days or perhaps even longer. Moreover, you may be seeing a lot of patients each day, so you may not remember to check on the results of the ultrasound. Some healthcare providers assume that the patient will get scheduled for the test, go for the test, and that the results will ultimately end up on your desk. That does happen most of the time, but unfortunately, sometimes things fall through the cracks. Sometimes patients decide not to have a test done, or sometimes the patient may end up going to a different radiology center than the one you usually use, and the results may not end up getting sent to you like usual. Whatever the circumstances are, it's very important that we not assume that each patient will have every test that we order and that every test result will end up on our desk. We need to have some sort of organizational follow-up structure in place to ensure that things happen as planned and that we get the results in a timely manner. One of the best tools for this is called the Tickler File, which can be managed by you or by someone else on your staff. A Tickler File keeps track of tests that you order and when the results are expected back. So going back to our ultrasound example, let's say that you order the ultrasound of the abdomen on Monday and you expect the test results to be completed and the results ready for your review by Friday. So you would have a list where you write down the patient's name, ID number, test ordered, and expected date for the results. Some clinicians also use a priority marker to list a level of importance next to every test ordered. So a CAT scan of the head after a car accident would obviously be given a higher priority than a standard cholesterol blood test. Your Tickler File could be a written record or it could be digital. Whichever mode you use, when you receive the test result, you would check it off on your Tickler File to document that you have now received the results and reviewed them. So each day, you review your Tickler File to see what tests you have not yet received and to follow up on those tests. If there is a certain test that you ordered and that you should have received by now, but you haven't, you would then take the necessary steps to ensure that that test has been scheduled appropriately. Most practices these days have an electronic medical record, and most of these systems have digital Tickler files integrated into their system. If your system does not have a Tickler file, then a handwritten system can work very well. But please be sure to have some sort of organized, consistent Tickler file in place to manage the test that you have ordered. This can be managed either by you or someone on your staff to keep track of the tests that you've ordered and to make sure that you have received all the results and that all tests have been followed up on and that nothing has fallen through the cracks. A Tickler file is a critical tool for clinical practice, and finding a Tickler file that works for you is paramount to an organized and efficient clinical practice that puts patient care first. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. Post your comments and experiences on the 5-Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD, or you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you subscribe on iTunes, you will receive all subsequent podcast pearls as soon as they are posted to iTunes. And if you enjoy the work that we're doing here, please head on over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.